Welcome to VR Nursing Academy. Produced by Rajendra Singh. Today our topic is Medication, Part 3rd. First question. A mother of a patient who is on antipsychotic drug asked a doctor about some more detail about the drug. The doctor told the mother that her son is taking an atypical antipsychotic drug. Which of the following is an examples of this type of drug? Option A. Chlorpromazine, B. Thioridazine, C. Haloperidol, D. Clozapine. In which correct answer is option D. Clozapine. Next question. A 60-year man with a history of intracerebral bleeding 3 months ago was referred primary health care following acute start symptoms. Brain CT scan is normal and the patient is receiving oxygen by nasal cannula at 4 liters per minute, BP 185 by 105, heart rate 82, respiratory rate 18, temperature 36.6 degrees Celsius. SpO2 93%. Which of the following one medication would be ordered first? Option A. Aspirin, B. Dopamine, C. RTPA, D. Nicardipine. In which correct answer is option A. Aspirin. Rationale. Probable acute ischemic stroke. Consider fibrinolytic therapy. If the CT scan shows no sign of hemorrhage, it is probable that the patient experienced an ischemic stroke and is a candidate for fibrinolytic therapy. Check for fibrinolytic exclusions such as significant head trauma or stroke in the previous 3 months, history of intracranial hemorrhage, elevated blood pressure, active internal bleeding, or a blood glucose concentration less than 50 mg per deciliter. Then repeat the neurologic exam. Consult neurologist or neurosurgeon. If the CT scan indicates hemorrhage, consult neurologists and neurosurgeons and begin the stroke or hemorrhage pathway. Administer aspirin. If the patient is not a candidate for fibrinolytic therapy, administer aspirin and begin the stroke or hemorrhage pathway. Next question. Nitroglycerine administration route. Option A. Intramuscular, B. Subcutaneous, C. Sublingual, D. Oral. In which correct answer is option C. Sublingual. Next question. Doctor ordered to give ofloxacin Otacrude. The nurse understand that medication will be given. Option A. Sublingual, B. Nasal, C. Eye, D. Ear. In which correct answer is option D. Ear. Next question. A patient is being admitted in medical unit and has orders for fluid restriction of 1400 milliliters per 24 hours. He is receiving IV medications in 50 milliliters solutions QID. How much fluid should the caring nurse allocate for intake in 24 hours? Option A. 1200 milliliters, B. 1000 milliliters, C. 800 milliliters, D. 400 milliliters. In which correct answer is option A. 1200 milliliters. Next question. Nurse gives health education to patient in outpatient department regarding a medication. She told him, avoid working outdoors in a hot weather. Excessive sweating add during water daily. Which of the following is most likely medication? Option A. Monoamine oxidase inhibitor, B. Lithium carbonate, C. Haloperidol, D. Diazepam. In which correct answer is option B. Lithium carbonate. Next question. A 40-year-old client who diagnosed with brain was scheduled for craniotomy. It is important to preventing the developing of cerebral edema after surgery. What medication would the nurse expect to prescribe the client? Option A. Antihypertensive. B. Anticonvulsions. C. Diuretics. D. Steroids. In which correct answer is option D. Steroids. Next question. A nurse checked the medication chart of a patient, which has the following order: paracetamol 500 mg PO, QID. How many times a day should they administer the medication? Option A. 3 times. B. 4 times. C. 2 times. D. 1 time. In which correct answer is option B. 4 times. Next question. A patient was on a regular dose of lithium carbonate. The nurse noticed he has hand tremor, polyuria, diarrhea and vomiting. What immediate action should be taken by the nurse? Option A. Monitoring serum lithium level. B. Calling the psychiatrist. C. Withholding lithium. D. Diuretics. In which correct answer is option C. Withholding lithium. Next question. When a patient was first diagnosed with schizophrenia, one of family members asked the nurse about the possible causes. The nurse said that one reason is that he may have had an excess secretion of a neurotransmitter. Which of the following neurotransmitters? A. Serotonin. B. Dopamine. C. Glutamate. In which correct answer is option B. Dopamine. Next question. After teaching a 50-year-old patient with angina on how to take nitroglycerine sublingual PRN, which of the following statements reflect the patient understanding? Option A. It is ought to take 1 tablet daily to prevent the heart attack. B. This medication will regulate my heartbeats and I will be. C. I can take 2 tablets together at once if the attack is. D. I have to take this medication once I need it only. In which correct answer is option D. I have to take this medication once I need it only. Next question. A nurse assigned to care for a group of patients in the median expected to review the medical records of these patients. What patient is at risk for excess fluid volume? A. Patient with chronic renal failure. B. Patient hooked to gastrointestinal. C. Patient taking a loop diuretic. D. Patient with ileostomy. In which correct answer is option A. Patient with chronic renal failure. Next question. During health education for a patient on monoamine oxidase inhibitor, MAOI, the nurse instructed him to avoid certain foods that can interact with the MAOI. Food containing which of the following contents should be avoided? Option A. Tyramine. B. Folic acid. C. Caffeine. D. Alcohol. In which correct answer is option A. Tyramine. Next question. A physician has ordered clindamycin phosphate 300 mg to be administered intravenously. The available stock was labeled clindamycin phosphate 900 mg in 6 ml. What is correct dose to be administered the nurse? A. 8 ml. B. 6 ml. C. 4 ml. D. 2 ml. In which correct answer is option D. 2 ml. Thanks for watching. Please like, share, and subscribe the channel, and press the bell icon for notification. If any query, please comment.